Today we will discuss the gross anatomy of the spinal cord. As you all know that spinal cord is lower elongated portion of the central nervous system. It is cylindrical in shape. Its length in adult male is about 45 cm and in adult female it is about 42 cm. The weight of the spinal cord is approximately about 30 grams. The spinal cord extends from the upper border of the posterior arch of first cervical vertebra up to the lower border of the L1 vertebra. The lower tapering end of the spinal cord is known as conus medullaris. The function of spinal cord is to execute the simple reflexes as well as to transmit the impulses to and from the brain. We will discuss the external features of spinal cord under following heading. The one is the features and different sulci. The other one is the attachment of the spinal nerves. The third one, enlargements, and the fourth one, coda equina. On the anterior aspect of the spinal cord, there is one anteromedian fissure and two anterolateral sulci, whereas on the posterior aspect of spinal cord, there is one posterior median sulcus, two posterior intermediate sulci and two posterolateral sulci. The anterior median fissure is deep and extends throughout the length of spinal cord. It contains anterior spinal artery. The posteromedian sulcus is a faint longitudinal groove from the floor of which a neuroglial tissue extends into the substance of spinal cord to varying extent, which is known as posterior median septum. The anterior median fissure and posterior median sulcus divides the spinal cord into two halves. Each half of the spinal cord is divided into anterior, lateral and posterior region by anterolateral and posterolateral sulci. Through the anterolateral sulcus emerge the ventral root fibers of the spinal nerve, and through the posterolateral sulcus enter the dorsal root fibers of the spinal nerve. If we discuss the attachments of spinal nerves to the spinal cord, you will know that the 31 pair of the spinal nerve emerge from the spinal cord. Out of these 31 pairs, 8 are cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal. All the cervical vertebra will leave the vertebral canal above the corresponding vertebra except the 8th one, which will leave the cord below, which will leave the vertebral canal below the 7th cervical vertebra. Below this level, the remaining spinal nerve will leave the vertebral canal below the corresponding vertebra. Each spinal nerve is attached to the spinal cord by two roots, anterior motor root and posterior sensory root. Posterior root contains a ganglion known as posterior or dorsal root ganglion. Each of these roots is made up of several rootlets. Like vertebral column, spinal cord is also segmented. So, the spinal segment is an area of the spinal cord to which one pair of spinal nerve is attached. So there are total 31 spinal segments, out of which 8 are cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal. But as the length of spinal cord is comparatively short than the length of vertebral canal, the corresponding spinal segment will be somewhat higher than its numerically corresponding vertebra. So let us now discuss the cervical and lumbar enlargement. Spinal cord is roughly cylindrical in shape with an average diameter of about 1.25 cm. However, opposite to the attachment of the nerve roots that contribute to the formation of brachial and lumbosacral plexus, the spinal cord presents definite fusiform swellings which are known as cervical and lumbar enlargement respectively. These cervical and lumbar enlargement are produced due to presence of large number of large motor neurons in this region to supply the musculature of upper and lower limb as well as respective girdles. The cervical enlargement extends from C5 to T1 spinal segments, whereas lumbar enlargement extends from L2 to L3 spinal segments. As you all know that the length of spinal cord is somewhat shorter than the length of vertebral column. So as we move downward, the length and obliquity of the spinal nerves gradually increase so that the spinal nerve can pass through their respective intervertebral foramina. Because of this, the last 4 lumbar, all 5 sacral and first coccygeal vertebra take somewhat vertical course and they form a bunch of nerve around the filum terminale. That bunch of nerve resembles the tail of horse and known as coda equina. In adults, spinal cord extends from the upper border of the posterior arch of atlas vertebra to the lower border of L1 or at the level of intervertebral disc between L1 and L2. So, knowledge of the lower end of the spinal cord is very much helpful in performing the lumbar puncture. Lumbar puncture is usually done to withdraw the cerebrospinal fluid for various diagnostic as well as therapeutic purposes. So, this lumbar puncture should be done well below the termination of the spinal cord. A horizontal line joining the highest points of the iliac crest passes through the spine of the L4 vertebra. So in adult, the lumbar puncture needle is passed just above this spine to perform the lumbar puncture. As you all know, at birth, the lower end of spinal cord lies at L3 level. So in case of children, lumbar puncture should be done well below this L3 level. So to perform lumbar puncture in children, the space between L4 and L5 is preferred one. So as you know that the line joining highest point of the iliac crest corresponds with the spine of L4 vertebra. So to enter the space between L4 and L5, the lumbar puncture needle is passed below the spine of L4 vertebra, whereas in case of adult it should be passed above the spine of L4 vertebra.